So delighted to be here as our first Dementia and Palliative Care conference, hopefully the first of many. As a hospice, we're passionate about making every day the best day possible for our patients and those closest to them. And it's really important we understand the trajectory of dementia care so that we can ensure that we're delivering the best care possible to our patients with dementia. And this conference brings those two worlds together. We've got so many national, international and local speakers talking today.
So I think this conference, being the first of its kind, is a fantastic opportunity to present what I wanted to talk to this audience in terms of where we are in terms of dementia awareness, prevalence, projections, etc. within the community, so that we can come together, share our ideas, network, and hopefully work towards developing a useful and sustainable pathway for managing dementia.
And I think this event's really important for the local professionals, health, social care, but also for people affected by dementia who live in Devon. If such an event can actually rally people to do more for this group of people, that's got to be good.
The voice of a person with dementia is here in what we've heard, and really listening to that and hearing that and the experience of carers in terms of shaping their own practice.
I've been in nursing for 37 years, so I've always worked with older people, and dementia has always been a passion actually. And I've got an absolute mission that as a society we all need to be more aware of what dementia is and how to support people to really live well. So yeah, I'm unbelievably passionate, and I just think it comes from years of experience and observing excellent care but also really poor care as well. And I just want all staff to have the skills and the ability to be able to do optimal care and support. Really, it's about enabling people to live well.
There is a group of really committed, motivated professionals right next to them in this county and across this county, all willing to try and make a difference.
So it's important to realize that people with dementia are people and human beings. And like most human beings, they want to live. They do not want to be treated as a patient constantly and reminded to their disease. And that means that we have to change our care homes and system, because that's focused on the disease. So I talk today about shifting away from the institutional model, the medical model, the clinical model, towards a sort of holistic model, a human model, where we look at people with dementia as people and look at their abilities instead of their disability.
So I think we need to open up the conversation and talk about what is palliative care and how do we provide it for those living with dementia.
I'm hoping that delegates will go away having had the experience of a beautiful surrounding with a little bit of headspace to think themselves about what's really important in their professional practice and where they may be able to make some changes that affect outcomes for people of all ages.
We have plans as a hospice in terms of a 60-bed specialist dementia nursing home. I've been blown away by the amount of interest and the number of people that travelled across the country to be here from other hospices, from the NHS, caregivers and individuals living with dementia themselves. So it's a fantastic event.
We can't change this situation on our own, and actually I really hope the delegates get to meet each other, talk to each other, share ideas, disagree, agree, and come up to find the solutions that we really need locally.
As you all know, dementia is a chronic, life-changing condition. It's important that the awareness of dementia is increased within the community to enable people to have a good quality life.
What does it mean, palliative care in dementia? How can we expect to support people? What conversations do we need to have? And I think it really is about making changes. It's hard, it's difficult, but we can make a massive difference. But it's opening the doors of conversation, so important.
We sometimes talk about a mission, or now we talk about a movement of change where we see new initiatives popping up. And so that's great. And every step forward is great. Talking more about life, living, but also about a comfortable death or dying. And so that's what we have to do. Live your life to the fullest and then die peacefully and with comfort.
I think when professionals come together on a day like this, it gives you a chance to really look what other people are doing. And we talk a lot about best practice, but best practice starts with knowledge sharing. So today has been a day of sharing knowledge, and I'm just so grateful to be here and to have learnt so much from the day. So thank you to Rowcroft.